Welcome to Mind Myself's podcast, Conversations with E. I'm Esther, and it is our pleasure to be bringing you these conversations with practitioners and people who are navigating their own health journeys. Remember to stay curious, live consciously, and become your own best health advocate because you matter. Welcome to the show today. Our guest is Vicki Mondlock, MD. Welcome, Vicki. We're so glad you're here.
Thank you. Thank you so much.
Awesome. Now, I know that we have a topic that most people don't get to talk about, and that is you died on an operating table twice and are still here talking to us today. So what stories you have to share? Just before we get into that, can you introduce yourself and tell us a little bit about who you are and your background?
Well, thank you. Yes. I'm a retired OBGYN wellness doctor, and my career started in research. I did research for 3 to 4 years before I then went to medical school, did my training residency in 1 year of internal medicine, then switched into OBGYN. I did traditional OBGYN, delivering babies all times of day and night for 16 years, became president of an 8-physician OBGYN group, developed a perimenopausal menopausal clinic within a clinic for women, because I was going through perimenopause and I knew my patients knew nothing about it either. My partners called it fluff. So I walked and I went solo. And in my last 25 years of practice, I did consented targeted research on my patients to develop my system of optimal health and hormone balancing for age appropriate hormone levels for women, which also translates to men, for how do we achieve optimal health and prevent chronic disease.
What a varied, storied, and incredible career you've had. And I know we could spend our whole time talking just about that, but we're going to backtrack a little and talk about some of the things that led you to where you are, not just the education, but your own personal experiences. Tell us a little bit about the first story that really got your attention for something radically different.
Well, when I actually got into medical school, first semester, it's didactic. You're in class. It's like college. So your first 2 years, you're just going class to class, lab to lab. And I develop a fever of 103.5 and peritonitis. Well, any normal person is going to go to their doctor and say, I'm sick. What's going on? Well, I'm a medical student. You don't miss class. So I do the second best thing. I go to the school doctor, right? They're just up on the 3rd floor. So I go see the school doc, and he starts calling in specialists from the medical school because he says, I don't know what's going on. Now, that's not very comforting, right? The school doc, and they don't know what's going on. Now, to be fair, this is pre-ultrasound, pre-CT scan, pre-MRI days. So all docs had was their stethoscope, their hands to do a physical exam, and their ears to listen to you. That's all we had. So I am now seeing, after day 3 of this, the 5th specialist. And the 5th specialist comes in, and GYN, gynecology, and he says, I'm going to do a pelvic exam on you. So I get up on the table. I'm in pap smear position, they call it. And
our favorite position as women.
Well, we all understand the vulnerability of that position.
Mm-hmm.
And this gentleman, doctor, does my pelvic and palpates a mass. And he says right off the bat, you have Mittelschmerz. You have a cyst on your ovary that you have not ovulated. And okay, what do I have to say about that? Okay, so he says, I'm going to manually ovulate you. Now, we all know as women what a bimanual pelvic exam entails. And it's an abdominal hand and a vaginal hand. And to manually ovulate means you are going mush, mush, mush on what that mass was an appendix that had ruptured into an abscess. So it was a pocket collection of pus. Did that hurt? Oh my word, yes. I have the school doc on one shoulder holding me down with both hands, his nurse on the other shoulder holding me down. I am screaming because I am being assaulted. And when he finishes, he turns around, throws his glove in the garbage, and says, "Don't you feel better?" And he walks out. The doc on my shoulder apologizes to me, but I have to get dressed and go back to class. So I dutifully get off the table, somehow get dressed, get myself back down to class. 10 minutes into the next lecture, it felt like somebody took a shotgun to my belly and just blew it. And I just groaned and went out, passed out cold on the table because it started the rupture of that abscess. So what, of course, do I do? I'm admonished for disturbing the class.
You passed out on the floor and they're admonishing you for disturbing the class.
Right. Because this was a visiting lecturer and he was renowned. And what business do I have disturbing this class? Right. Priorities. Right. So I, with my friend, she gets me back up to the doc's office and he goes, "Well, I don't know what's going on, but we have to operate." So that night, 10:30 at night, I'm being wheeled into the operating room. My husband is standing next to the gurney, and the surgeon who's going to open me is standing next to the gurney, and he says, "Do you have any questions?" And this is my time to say what I think is going on. Not that I haven't said it before, but now I get to say it, right? And I said, "Yes, I may only be a freshman medical student, but why is my diagnosis a twisted ovarian cyst when I have a fever of 103.5 and peritonitis? It doesn't fit." Now, I'm speaking to the chairman of the Department of Gynecology, who's going to have a scalpel in his hand on my belly. Was I insane? Yeah, maybe. This is a little bit of shock setting in, So he literally grabs my hand and he goes, now, dear, that's why I'm the staff and you're the student." I'm powerless. What can I do? I needed to go to the operating room, so I have no choice, right? Yep. So the rest of the story is told to me by a surgeon that was in the room where it happened. And so the story goes, I'm brought to the operating room, and this chief of department does a pelvic bone to pelvic bone incision, which is to look at the pelvis. That's what a gynecologist does, right? Well, except it wasn't a pelvic diagnosis when he opened me up, his words were OSH blank blank. And they had to temporarily close me because I was just full of pus, and call in a surgical team because they realized this wasn't anything gynecologic at all. This was an appendix that had ruptured. So while the surgical team is making its way into the operating room, I die on the table. I flatline. And the surgical team comes in and goes, holy SH, this is the wrong incision, but we have to act fast. Plus, she's a medical student. She'll need to get back to class. What are we going to do? So the dilemma was close the first incision, make the right incision where you have enough room, or work through the wrong incision because she died on the table already. Time is of the essence. Well, they made the second decision to work through the wrong incision. And the next I'm aware of anything, I wake up, NG tube, which is a nasogastric. So it's something that will go down to your stomach and literally suction out all contents of what your GI tract has going on, stomach wise and whatever. So it's a quiet GI tract so it can heal, right? So dual IVs, one in each arm. And for anybody who's ever awakened from surgery, you don't wake up and see things clearly. It's like looking through Vaseline glasses, and you're like, trying to figure out what's in the room. And so at the end of my bed is a gentleman in a suit. And my first thought literally was, wow, St. Peter, you look different than I thought you would.
Be the good Catholic girl that you are.
Right. Wow, I made it to heaven.
Yeah. Oh, that's funny.
And he straightens up and fixes his tie and he goes, Victoria? Yes. Well, I'm from the medical school. And I'm thinking, oh, isn't that sweet? He's here to check on me. And he goes, you realize you've missed your exams? Oh. I said, I think I had surgery. And I lifted my sheet up and I went, yeah, the original surgical dressing is still there. And he goes, that's not my concern. My concern is to tell you, you missed your exams. And if you don't get your butt back to class and you miss 2 sets of exams, he said, you're in danger of being kicked out of school. Do I make myself clear? That's what I got from the medical school.
Wow. So you died on the table. They brought you back. They cut you open with the wrong thing before you died. They did another surgery through the wrong incision. And then the guy says, oh, yeah, sorry, you didn't get to class. So you're in danger of being expelled.
Right.
Wow.
Right. So he gets up and leaves. And what can I do? I haven't even talked to the surgeon yet. Right. So when the surgeon who did the right surgery through the wrong incision, the actual surgeon, general surgeon, comes in, he tells me what they found. I was in the hospital for 5 days. I was back in class 8 days after the surgery because I had to be. So the surgeon actually is the one. Now, we're talking a medical school situation. You rarely see the surgeon. You see all of the underlings who are taking care of you. Well, the surgeon came into my room and said, I'm giving you this book. And he handed me a book called The Diagnosis of the Acute Abdomen. And in the book, he hand wrote, the next time you decide to have a clinical correlation with what you're learning in medical school, please call me first. So, because of course, first year you're learning anatomy. So he was very gracious. What I want to impress on everybody listening is you're all ready to hear what did the first surgeon who opened you say to you? He never came back to my room. I never saw him or heard from him. Now, I'm just going to leave a rhetorical question. Is that how any patient would expect to be treated by their healthcare provider?
Absolutely not. I know it was a rhetorical question, but absolutely not. We all know that.
Right.
So, what's your message? I know we have other stories to get to, but what's your message to someone if they do have an instinct? Because our bodies are telling us things all the time. And even if we're not a medical student or a doctor or a nurse or in any medical capacity, what do you recommend we do?
Write it down, what you think, say it out loud, advocate for yourself, whether they follow up on your statement or not. You have put it out there. And
Correct.
you now have a record that this is what I said. And you now have advocated for yourself, and you may have recourse for actions that show that you were right and you were ignored, and your approach and your self-advocacy was worthwhile because it may have caused you injury that was unnecessary, and you may have recourse.
Absolutely. So, regardless of the last two, although you may, definitely think it, say it, write it so it's on record and put a date on it.
Yes,
That's right.
absolutely. Absolutely. And make sure it's witnessed. Like my husband was my witness. The
Yes.
second doctor was my witness.
Yes.
And so I, being a medical student, had the dilemma of, do I whistleblow or do I preserve the career path that I've just started and not prosecute the chief of the department of what I ended up going into?
Right. And so let's talk about your decision and then what happened after that.
So my decision was, do I even stay in medical school? Is this what a doctor really is? I've got two different examples. I've got the guy who pats me on the hand and patronizes me that he's right and everybody else is wrong. And then I've got the doctor who goes, please learn everything you can so that we never end up in this situation again. Which doctor would you want to emulate? Well, obviously, door number two, right?
Yeah.
And I thought really hard and long about it. And I thought, do I quit? No. Stay and be the change agent.
Yes.
So that's what I decided to do. Was it tough? Oh gosh, yes. I had 8 days of medical school to make up. And most people hear that and they go, 8 days. Come on. Well, that's like a lifetime. Okay. And so literally when I finished, then did my residency. Again, never heard anything from the first physician, even though that's the field I ended up going into. Okay. And I did my training in the same town. So this is all happening within his sphere of influence, shall we say. So that is story number one. And I actually then, finished my residency. I've gotten pregnant, delivered my first child. So I finished my residency with my husband and a 3.5-year-old. And I'm pregnant with my second child.
So let's hold right there for 1 second. So you're in medical school, you complete that, you do your residency, you have a child during this time, and then you get pregnant with child number two, all while all of this has happened is happening. You complete your different, oh my gosh, with two children. So let's
Right.
carry. I just want to emphasize this is no small task that you just said a sentence about.
Right. And so for people that don't realize what residency is like, you're on call every third night. And when you do your 24-hour of overnight call, you don't go home the next day. You work your full 8 to 10 hours the next day as well. Then you get to drive home, sleep deprived, and make it home without killing yourself. And then you've got one day off that you're still working, but you at least get to sleep in your own bed and go home at the end of the day before you do it all over again. So residency is you learn a lot, but it's a blur because every moment that I had with my husband and my child, my husband has all of these pictures of me sleeping on the floor next to my 1-year-old, 2-year-old playing around me. So I have these targeted, very specific memories, but the pictures are really what give me my memories. I don't have a whole lot of memories of that. So
you lived in this haze of sleep deprivation and intense learning and growth, but wow.
right,
Okay,
right.
you're pregnant with your second child, and what happened?
I am finishing my residency and I am 5 months pregnant. We are now 10 years post the first surgery where I had everything that happened to me on the first surgery happened. 10 years down the line, I am now graduating from my residency program and 5 months pregnant, and I go into a bowel obstruction. What is a bowel obstruction? Well, most of us, when we put food or water in, we just expect that it will go through. We will absorb the nutrients in the fluid, and then whatever we don't use, we eliminate. Well, if you disturb that pathway, the GI tract still wants to push things through, and it will work harder and harder to push things through a blockage. And if it can't push it through, things will eventually back up because you still make juices and digestive enzymes, and you still dump these in to take care of what you're supposed to be putting in your stomach, but it has nowhere to go. So eventually it has to go somewhere. And a bowel obstruction means if it doesn't go through, it backs up like a sewer. And so literally at 5 months pregnant, we move into our house. My husband is drilling and putting something in the front door, and I start cramping to the point where I'm on the floor, curled up in a ball. I can feel the baby kicking, but I know this is not good. And my 3-year-old, I said, go get daddy. And to her credit, literally, she grabs my hand and she goes, Mommy, I'm right here. Sweetheart, go get your daddy. No, Mama, I'm right here. Go get your daddy. So she did not. 45 minutes go by.
Wow.
And when he finally comes into the kitchen to get a glass of water, he sees me on the floor and he's like, are you okay? I'm like, no. So to the hospital we go, and I have scar tissue that has caused this block, right? So now my history is known that I've had this prior surgery with ruptured appendicitis. So 5 months pregnant, nobody's just going to make a rapid decision. Oh, we just have to open you. That's a pretty big decision. But they decided they had to at least explore because there's likely scar tissue in there. And if they can just get rid of scar tissue, maybe it's just a band that is like a like a guitar string that things have wound around. And that's exactly what it was, that they could just snip that and everything would settle back down. So that was a 6-day hospitalization because you can't just take pain medication. You have to have epidural medication that will cover your pain because less of it gets to the baby. And everything that goes along with being a pregnant patient on the OR table.
Oh.
So I recover from that. I start my resident or my job as a full-fledged practicing OBGYN, right? I made it, right? I got a group. I've got patients. I'm on call, my usual, day and weekend and whatever. And I'm 2 days from my due date. Now, this is the pregnancy that I had the bowel obstruction at 5 months, right?
Mhm.
I get to within 2 days of my due date, and I start having GI symptoms that sound all and look all too familiar. Now, I'm the OB. I don't know if this is labor or not because I can't even check myself because I don't know which end to put over the toilet,
Yeah.
And so my husband takes me to the hospital. Obviously, I have to call a partner. They have to take my call. They check me and they say, "You are not in labor." And my whole world, oh crap, I know what this is. This is another bowel obstruction, right? So they deliver Stephanie, my second, vaginally, thinking, okay, decompress that uterus, get the baby out, maybe everything will settle down. Oh, no. So back goes an NG tube. Now I've got a newborn and who's in the nursery. I'm on the regular OB floor postpartum, but with an NG tube, and I can't have water or anything else. And I'm getting morphine because I can have morphine now. I don't have a baby in utero. Well, I'm in the same hospital I trained at. So I know all the nurses, they know me. And by the second evening of the second day, the surgeon is frustrated that things are not declaring, that I still have, fluid coming out of my NG tube, yet I'm joking, I'm laughing, unless I move, then I pass out with pain. But I'm on morphine, and he's thinking that I'm drug seeking. So he sends the nurse in Friday night. This is again the evening of day 2. And the nurse has a little pill cup. And she goes, "I have your medication." And of course, I know her. So I looked at her and I said, "I think you're in the wrong room. Remember, I have this tube sucking everything out of my stomach. I don't get anything by mouth. This goes to another room." And she goes, "Well, I shouldn't be telling you this, but the doctor wants to see if your pain is real. This is a sleeping pill." And I looked at her and I thought, this isn't her fault. But I need morphine. So I looked at her and I went, "Who's the resident on call tonight?" And she goes, "Oh, wait a minute. You wouldn't dare." I said, "Oh, try me. I need morphine. You know that. The doctor knows that. He's not giving me the morphine. So I have the means to get the morphine from the residents." I said, "All I have to do is ask." I said, "Now, we can do this the easy way, or we can do this the hard way." I said, "The easy way is you turn your butt around, you go back to the nurse's station, you tell him that patient is being a horse's patoot and is demanding morphine. And what should I do? I said, now you have put the decision back on him. I said, the hard way is you don't call him. I still call the residents and get morphine from the residents. And in the morning, you're going to lose your job because you defied his order and you didn't call him. I said, then it's on you. I said, so do you want to do this the easy way or the hard way? She turned around. She went back to the nurse's station. She called him and I got my morphine, but he punished me by not coming in until the afternoon of the next day. So by then, I actually have a fever and peritonitis again. So he says, well, we have to go to the operating room. Well, obviously. So the chief resident, who is the year behind me, walks in after the surgeon leaves and he goes, can I be in on your surgery? And I said, you have to be. You are my eyes and ears. Because that Jack ASS isn't going to tell me the truth. Because he hasn't been truthful with me. He's proven he will not trust what I am telling him. So I need you to be my eyes and ears. So I get taken to the OR. When I wake up in recovery, my husband is holding our newborn and he's crying. And I said, why are you crying? I just had surgery. And he said, they told me you died. So the resident walks in and I said, all right, what happened in there? And he goes, he opened you up and your bowel was black. Black, not pink, healthy, moving, black. He said he touched it and it exploded. And he said there was pus everywhere and you flatlined. And he looked at me and he said, holy SH, she was telling the truth. I can't make that up, you know? So what possible thought process did this doctor have that I was drug seeking? That I, as a mother of two with a full-fledged MD practice, was drug seeking? That doesn't even make sense. I don't know what he was thinking, that I'm trying to defy him by not telling him my symptoms. I was very forthright with my symptoms. Was it that I'm a female physician and he can't figure it out? And I'm telling him what's going on.
So we're definitely dealing with some egos, and that hasn't gone away.
Right.
How long ago was this, that last incident?
This was 1988.
So quite some time ago. Let's fast forward a little bit to today and just say, has anything changed? What would you say to somebody, whether they've got to the state that you got, the extreme state or not? What would you say to somebody today in today's Western medical milieu?
Trust yourself. You live in your body. You know when your body is doing something right. You know when your body is doing something wrong. You may not know the right words in medical speak to say what's going on, but you know. And these days we have watches that give us our pulse and sometimes even a blood pressure. And it tells us, you know, are we moving or not? We know if we can stand up straight or not. We know if we're taking pain medication for something or we're tempted to take pain medication. We at least in this timing have ultrasound and MRI and CT. We have an ability to do more of a look before we have to go in. I said to every single one of my patients, I want you to tell me what your version of what is going on with you is. I want what you bring me from the internet. I want your impression of, I want to know what's happened to you in the past and what other diagnoses you have, because that impacts how you are perceiving what you have going on right now. So I learned from my experience, patients live in their body. You don't live in their body. And if they tell you, I hurt, that's real. And it's my job to figure out why. And so it's well worth every person's best interest to document, open your mouth and say, I hurt, document what symptoms you can document. And if you're not being heard, you have a second opinion option that you can go to. If you still don't like what you're hearing, you can actually go these days on social media and say, I have this and this. Has anybody had? We have more options to explore, but we also hopefully will choose healthcare providers that will at least go, I don't know what's going on, but I'm going to help you find out. If that doctor can swallow their ego and their pride and say, I don't know, you're at the right doctor's office.
I love that. So again, to recap, pay attention to what's going on inside you, body, mind, spirit, all of it. Pay attention, document it, write it down, put it on a computer, whatever it is. Get it witnessed, just in case, like somebody that you trust, put the date on it, and then get an opinion and speak. And if it's, I know that I say this to some people, if that's hard for you because of white coat syndrome or whatever, bring a friend or a trusted colleague or a partner to the doctor's appointment with you. And if that doesn't work, get another opinion. I love
Yes.
that you've said that.
Yes.
So important.
Right. And I would hear from patients all the time, but I like my doctor. Well, that's fine. You can like them, but that doesn't mean they're serving you well as a doctor. You're not asking them to go out for coffee with you. You're asking them to take care of you.
Mm-hmm.
And they could be the crappiest doctor in the world, but if they're good at what they do, then you're in the right doctor's office.
I love it. And I also love that you encourage people, even when it's complicated, to stick with it. And if a doctor can actually say, I don't know, because maybe they've tried everything that they know with you and none of that serves or works, and they get to the point of, I don't know, great. Because you want some help at that point.
Right. And that means the doctor is also willing to help you look for that help.
Absolutely.
And that's just human nature. I mean, I would feel awful. And I vowed to myself, I would never let anybody get into the situation I got into, that I felt trapped because I felt I couldn't sue someone of my profession while I was in training. That would have been suicide to continue with medical school. I would have been kicked out for different reasons. They would have made something up. So my decision to stay and be a change agent was yes. My personal decision, but it was also my professional decision. But it took me on the course of who I needed to become.
Mm-hmm.
I needed to be the best at what I could be And I needed to be the voice of the patient who didn't know what to say. And when I was in my solo practice, the favorite patient that I had, and I wasn't delivering babies anymore by then. I had had my 3, and that was enough. But when I was doing my solo practice, my favorite patient walking in would say to me, I don't even know why I'm here. You're the 12th, you're the 15th. I had one patient say, you're the 18th doctor that I've seen, and I don't even know why I'm here, except this friend of mine said, go see her. She can help. And wow.
Hmm.
And I could, which is what was so gratifying, because no patient ever walked out of my office saying, you couldn't help me.
Hmm.
I could. And that is my legacy.
Mm-hmm.
Sorry.
No apology. Emotions are great. Yeah.
It's something that a lot of docs don't understand because they've never encountered their own humanity
Mm-hmm.
with illness.
Or their own mortality.
Or their own mortality. Right. Yeah, they may have had, a kidney stone, or they may have had a minor issue. Maybe they're on medication for something. But how many doctors have faced death and come back and talked about it? Not too many.
Absolutely. And Vicki, as we bring this amazing conversation to a close, I just want to say thank you so much for your courage, for your determination, for your persistence, for your unswerving commitment to look at everything until you find solutions. Like you said, that is rare. I think there are people in the world who do that and who are committed to it. And you are one, you are a shining light to us. And thank you. Thank you for your service to the world and to women. Thank you.
You're welcome. And I just want to say, as the patient, if you aren't getting heard, you're in the wrong office. So that's not your fault. It just means you're in the wrong space. So there's nothing wrong with a second opinion. There is nothing wrong with asking a question. If you are admonished for asking a question, the first thought you should have is, I live in my body. Am I wrong to ask why? I used to say to my patients, I am the incessant 2-year-old. I ask why.
Why?
And in training, they would say to me, this is how you do it. And I'd go, why? So they always saw my hands start to creep up, and they'd go, well, the reason we do it this way is because they already knew what was going to come out of my mouth. And I got the reputation, even in my residency, that I was willing to challenge the status quo. And the nurses loved it because it meant they didn't have to challenge the doctor. I could challenge the doctor for them. And they were able to just sit back and take it all in. Because again, I'm talking the early 80s when I was in training. And that was just something you didn't do. The doctor was the authority in the room, and you didn't question as the nurse. Well, that dumb little female resident over there, she's going to raise her hand and go, why? So we'll let her take the heat.
Absolutely. So final words, Vicki, to somebody listening. What are your words of encouragement? We've heard so many great messages and encouragements from you today. What's your final word?
Advocate for yourself. You know your body. Do your research. Realize that research alone may give you some of the right answers. If you trust the doctor you're seeing and they're listening to you, great. They are going to be able to hopefully do the right tests and figure out what's going on. If they tell you it's all in your head or that you're wrong, then you're not wrong. You simply need somebody who's going to listen to you. So trust what you feel. Trust your process of how you've taken care of yourself for how many years, and you've done a pretty doggone good job of it. So trust that instinct. Walk in with information. And if you're not heard, find somebody else who will listen to you.
So great. We've heard it over and over and over today. And I know that that's what Mind Myself is about, helping you become your own best health advocate. And I'll leave you with this. We do all of this because you matter.